just wait for a few more minutes to let others join, and then we can start. Good evening, everyone. I'll just share my screen. Am I audible? Can you all hear me? Hello?
Yes, ma'am.
Okay, yeah.
I'm audible.
Yeah, thank you. So welcome back to the NPTEL online course for PMRF TA sessions for the course Drug Delivery Principles in Engineering, and this is week 8 course, and we have been discussing few of the concepts of drug delivery as well as tissue engineering, and then subsequently discussing the questions as well from previous year assignments. So I'll just move on towards the to few key points in this week. So last week we have been looking at different routes of drug delivery. So we have looked at oral route, which is one of the most conventional ways of delivering medicine. So this is the most patient compliant route of delivery because it is not invasive and patients are readily able to take tablets or syrups or capsules. But it also comes with its own disadvantages. For example, if a patient is unconscious, you cannot deliver the drugs orally. Also, whatever is delivered orally suffers from the first pass metabolism, which, if you people remember from our initial discussion, it's nothing but whatever you take orally, most of it gets metabolized in the liver even before it reaches the systemic circulation. In that way, you lose a lot of drug, and not everything is bioavailable through the oral route. So that's one disadvantage. And also, since your gut lining has a lot of mucus, as well as it turns into acidic pH in the stomach, so most of your drug gets degraded at these conditions if your drug is indeed acid labile. So these are few of the disadvantages of oral route. So, but there are ways to work around this. For example, if you want something to be delivered only to the intestine and you don't want the drug to be degraded in the stomach, then we looked at something known as enteric coating to avoid the release of drug in stomach, and instead the particle just passes through the gut, through the stomach, and then it releases at the intestine. And then we also looked at bioadhesives, which were nothing but coatings of polymer over your drug, which then increase the transit time of your drug because they then interact with the mucus lining. And then there are similar such ways of improving the bioavailability through the oral route. Then next we saw something known as intramuscular and subcutaneous routes. So these are parenteral routes, meaning they avoid the stomach route, the oral route. So in parenteral systems, we have one of the most common advantage for these routes is they bypass the first pass metabolism, both intramuscular and subcutaneous. Intramuscular is you inject the drug directly into the muscle layer. Subcutaneous is it's right below your skin. That's where you inject your drugs. So both of these routes help in bypassing the first pass metabolism. In that way, they are very advantageous. But since they are injections, they are a little invasive, and it's not recommended. It's not much patient compliant when you have to give very frequent dosages through intramuscular and subcutaneous. Also, it requires training. Patients can self-administer it, but then you have to train the patient for that. Just a minute. Yeah, then we saw another route of drug delivery, which was transdermal, which is delivering drugs through your skin layer. So this is also very patient compliant. You just make your drugs in a patch form and you can put it on the skin, and that's why it's very patient compliant. It's not invasive, and it also helps in local delivery to a particular area. But the disadvantage of transdermal route is, as we discussed, there is a layer called a stratum corneum in the skin, which is nothing but made up of dead cells, which then make a very impermeable barrier for most of the drugs to be delivered. But there are ways to enhance this transdermal drug delivery by destabilizing the stratum corneum, and we saw different ways to do that, right? We saw there are various chemical enhancers to do that, or you could use electric current to destabilize the layer, and then you can increase the permeability of drugs through the transdermal layer. Also, we have something known as microneedles. These are nothing but needles made out of polymer, which are around 100 to 500 microns in length. So what you do is you formulate these the polymers in this microneedle type fashion, and then you can insert it in the skin. So they will penetrate through the stratum corneum and deliver the drugs directly into the blood. Now, there's no pain in this. Why? Because your nerves start way below this 500 micron layer. So in that way, these microneedles will be destabilizing the dead cell layer, but they will not harm, they will not reach the nerve cells, and in a way the patient won't be able to feel any pain, but you are enhancing the transdermal delivery. So this is what we saw in the last few lectures. In this week's lectures, another various different routes were discussed. The first was inhalation. This is taking drug through the nasal route, and this becomes important when you want to deliver your drug specifically to the lungs. For example, there's some lung disease, for let's say there's an asthma patient. You don't want the drug to be circulated in the entire body, right? You want the drug to be gone specifically to the lungs. So in that way, inhalation route becomes very important. It also bypasses first pass metabolism, increasing the bioavailability of the drug. But in few cases, if you want the drug to be delivered to the blood through the inhalation route, then it becomes a little difficult, because now your drug has to have very specific dimension. It has to be small enough to reach the deep lungs. Deep lungs meaning the alveolar sacs. So the way your lungs are made, there's a lot of network of these vessels, the airways, which initially start at a very broad airway, and then we'll look at this in few of the subsequent questions as well. So as I said, the airways at the starting are very broad, but then they keep on branching, and eventually they become very, very small till they reach the alveolar sacs, and that's where your exchange of gases from the lungs to the blood occurs. So that's where your blood vessels are. So if you want the drug to be absorbed into the blood from the through this inhalation route, your drug has to be very, very small in size, and you use devices such as nebulizers and dry powder inhalers for this inhalation of drugs. So you must have seen people with asthmatic patients carrying these inhalers with them. So the pumps, which you call, so that's used for dry powder inhalation. So that's one route. And then we discussed an important concept related to inhalation, which is known as aerodynamic diameter. So as I said, if you want the drug to be delivered into the blood through the inhalation route, your drug has to be of a very specific size range. Specifically, it has to be within 1 to 5 microns, so that it reaches the deep lung level, and then it's easier for the drug to travel from the lungs to the blood. Now, if you remember, you must have gone through the lectures, and you must remember this, that the alveolar sacs are lined by a lot of phagocytic cells. These are your macrophages. So since our body has been evolved, our immune system has been evolved to defend any foreign material. So if your particle is within 1 to 5 micron range, your macrophages are very efficient in phagocytosing them. They will completely take it inside and destroy it. So your drug will be destroyed. So you don't want that. You want your particle to be within 1 to 5 micron, but you don't want them to be phagocytosed by the macrophages. So what you can do, you can make use of this aerodynamic diameter concept. This is nothing but, let's say you have your drug particle, and you have, this is an imaginary, this is a theoretical concept, this is not a physical concept. So you imagine you have a sphere which has the same settling velocity as your particle. Settling velocity is nothing but the speed at which, the maximum speed at which your particle will travel if you put it in a fluid under the gravitational force influence. So you imagine a sphere which has about the same settling velocity as your particle, and it has a density of about 1000 kg per meter cube, and then the diameter of that particular particle is known as aerodynamic diameter. So now what you can do, you want your particle to be of 1 to 5 micron diameter. So this diameter is nothing but aerodynamic diameter. The physical diameter of this particle can be different. That is what we are getting at here. So to avoid phagocytosing of your particles by macrophages, what you can do, you can make the particles very, very light. You can make them porous. This will then decrease their density. So in a way, now you have made a particle that is larger in size, but it has the same density as the previous particle. So now, because the physical diameter is much more than 5 micron, your macrophages will not be able to take them up. But since these are lighter now, these are very less dense particles, they can easily reach through your airways to the deep lungs, and they can be absorbed by the bloodstream. So what you have done here, you have made use of this concept of aerodynamic diameter in formulating these particles, which are less dense enough to reach the deep lungs to go into the blood circulation, but they cannot be phagocytosed by the macrophages. So we'll look at this concept in the subsequent questions as well, if it's a little confusing right now. So that was about inhalation route. Next route is buccal or sublingual. So this is nothing but the area in your cheeks and below your tongue. So this is one of the most traditional methods of delivering drugs. So if you people remember, sometimes when you were kids, doctors will ask you to take a tablet and keep it below your tongue for a long time. Like, you don't have to chew it, you don't have to do anything, it will just be absorbed on its own. So what this does it, even though this might seem like it's an oral route of administration, it is not. Oral route has to be, oral route means that you take something and it goes to your stomach and then gets absorbed into the blood. That is the oral route. But this route is different. Whenever you place anything below your tongue, there's a different blood vessel that carries anything, the drug, directly to the systemic circulation, directly to the blood. So this essentially bypasses the first pass metabolism. So this is one of the advantages of buccal or sublingual route. This is not much in use these days, but it's good to know that. Next is intra-articular delivery. So this is a little invasive. Intra-articular means directly to the joints. You deliver drug directly into the joints using an injection. So this becomes most prominent when you have to treat diseases such as osteoarthritis, which then affect your knee joints. So these injections are mostly used for curing that. So what you can do is, since osteoarthritis is nothing but there's an inflammation in the knee joint, so there's a lot of pain. So if you want to deliver drug, you just take an injection and you deliver it into the intra-articular space at the knee. So as you can imagine, since this is an injection, it's very invasive, and it also requires trained personnel, because you don't want to damage anything else when you're injecting something in the knee. So this is done by professionals. So that's about intra-articular delivery. And then the last route that was discussed is intravenous delivery. This is also a very common route of delivery in hospitals. So you must have seen people getting IV injections. They have IV drip. So these are nothing but intravenous delivery routes. So the foremost advantage of this route is it gives you 100% bioavailability, meaning now since you're injecting something directly into the blood, most of it becomes bioavailable because your blood will carry to each and every part of your body. So that's why it has 100% bioavailability. And another most important advantage of this route is immediate effect. So let's say there is a patient and he's having heart stroke. The heart has somehow stopped pumping. You want to relax the heart, so the medicine has to be given immediately, and you can't wait for the medicine to take effect. So what you can do, you can give an IV injection which then the blood will carry the drug immediately to the heart, and then it can have a very fast effect. But it is also invasive since it's an injection, and it requires trained personnel because you need to be very careful with where you are injecting. You don't want to rupture any of the capillaries. And also another disadvantage of this route is sterility. Now, since you are injecting everything directly into the blood, let's say your formulation was not very sterile when you made it. Somehow some pathogen gets introduced into the formulation. This now has direct access to your body through the bloodstream. So there are chances of getting infection with this route. So you have to be very careful when formulating medicines to be given through the intravenous delivery. So these are some of the routes of drug delivery, and with this information, then we can look at some of the questions now. Is it okay if I go ahead with the questions? I hope you guys can still hear me. Yeah, okay. So let's look at the first question. The first is, I hope you can see it on the screen. It's what is the ideal size range of nanoparticles such that it can traverse through the smallest capillaries inside the body and not get cleared by the renal system. So we have seen some questions similar to this in first or second week lectures. So if you guys know the answer, you can let me know, or else we can discuss. Anybody?
Option 1.
Okay, we have one answer as option 1. Anyone else wants to give it a try? Thank you for answering.
Option 1.
Okay, thank you. So I guess we have two answers with the same option. Anyone else has a different answer? I guess not. So yeah, both of you are correct. The correct answer is option 1. So we have to, the question basically is asking us what should be the ideal size so that your nanoparticles will go through the smallest capillaries but will not get cleared by the renal system. So if you remember, in the first few lectures we discussed how kidney filters the drugs. So this is how your glomerular filtration membrane looks like in the Bowman's capsule here in the kidney cells. So this is what you should be keeping in mind. So the narrowest gap that through which your blood gets filtered is around 4 to 11 nanometers. So if you have anything less than 4 nanometers, it will be easily cleared by the anything less than 10 nanometers, it will be easily cleared by the kidney cells. So you don't want your drug to be cleared by the kidney cells. So in that case, it needs to be more than 10 nanometers. So you got the smallest value here. And talking about the smallest capillaries inside the body are somewhere around 5 microns. So if you have anything higher than 5 micron, there's a chance that you might clog the smallest capillaries in the body. In that case, it will be very difficult to the therapy will fail in that case if you block the capillary. So the ideal range of nanoparticles should be in between 10 nanometers to 5 microns. Is this clear? Okay, I'll move on towards the next question then. Next is, which of the following is an ionic liquid? We have 5 different options, so you have to choose only one. Any answers?
Option 2.
Option 2, okay. Thanks for answering. Anybody else? No one? Okay, yeah, you're perfectly correct. The correct answer is option 2, that is choline and granite. So what is ionic liquid? These are organic salts that exist as liquids at room temperature. So these are mostly used as chemical enhancers to increase the permeability in the transdermal drug delivery. We were looking at the stratum corneum layer being a barrier for transdermal route. So you use some chemicals which then destabilize this stratum corneum to increase the permeability of your drug. So one of the class of such chemicals is ionic liquids, which are organic salts which exist as liquids at room temperature, and they are very good solvents for a lot of organic and inorganic material as well as polymers. So you have a lot of such materials on the skin in the dead cell. So two examples of ionic liquids are choline and granite. So yeah, that's the answer. Is this clear? Okay, I'll move on towards the next question then. Next is, the density of two particles are in a ratio of 1:16. What is the ratio of their aerodynamic diameters given all other parameters are the same? So if you know the conversion of, if you know how aerodynamic diameter is calculated, you'll be able to answer this. Let me know if you can. If not, then we'll discuss.
Option 3.
Option 3, that is 1:4. Okay. Thanks for answering. Anybody else wants to give it a try? No one? Okay. Yeah, you're correct. The correct answer is option 3, 1:4. So the conversion goes like this. The way you calculate aerodynamic diameter is, you take the physical diameter of the particle, which is denoted by d here, and take the root of the density of that particle. So if what you're given here is the you have the ratio of the density of particles, that is 1 is to 60. So if you put it in this expression, you take a ratio of the aerodynamic diameter, which will then be essentially, since the physical diameter, it says all other parameters are the same, so that means physical diameter of the particles is same, but you have a difference in the density. So if you just take root of this, you'll get 1 is to 4. So this question kind of tells you that even if two particles have the same physical diameter, their aerodynamic diameter will be different because there's a difference in their density. So as I said, if you make your particle less dense, its aerodynamic diameter will change. So this is the concept you use when you want to deliver drugs through the inhalation route. So I hope this is clear. So the correct answer is option 3. Shall I move on? Okay. The next question is, what size range of particles are well suited for deep lung delivery? I think we discussed a few of these. So if you know the answer, please let me know.
Option 4.
1, 2, 3, 4. Yes, you're correct. The correct answer is 1 to 5 micron, as we were talking right now. So if you've gone through the material in the lectures, you would have come across this slide where it talks about dry powder inhalation, and herein you see it's mentioned that powder particles should be around 1 to 5 micron to reach the deep lungs. I hope this is clear. Okay, no doubts here. Then I'll move on towards the next question. Next is the mechanism of particle deposition into the lungs for large airways, bronchioles and alveoli in order R. So we have 6 different options. We have to choose one. Anybody wants to try?
Option 1.
Option 1 is impaction, gravitational sedimentation, and Brownian diffusion. Okay, thanks for answering. Anybody else? Okay, let's look at the answer. Yeah, you're correct. The correct answer is impaction, gravitational sedimentation, and Brownian diffusion. So what this is, this is what I was talking about a few minutes back. So there's a very intricate and very fine network of airways in the lungs. So it starts with your trachea, which is a very broad airway, and then it goes on branching, which we call as generation. So your zero generation, your first generation will be something like this. So first generation is where your trachea kind of branches from here, and then you'll have several different branching, which are then subsequently called bronchioles. Then if you have even finer branching later on, it will then be called as alveolar ducts, and it will eventually reach the alveolar sacs. This is where the exchange of gases happens. So what happens is when you deliver any particle, any drug particle through the inhalation route, it initially undergoes something known as impaction, which is because of its inertia. Inertia meaning because of its momentum, which is nothing but virtue of its mass and the velocity with which it travels. So if you have very large particles, if the mass increases, it's directly proportional, right? More the mass, more will be the impact of the particles. So if you have a very heavy particle, it will initially have a very strong impact. It will not be able to deflect in this way. So if your particle, imagine this pointer is your particle. If it's a very heavy particle, it will come and it will just directly bounce on this. So it will have a very large impact on this wall. It won't be able to take a turn like this. So in a way, if it touches the wall, there's a lot of mucus lining this wall. So it will essentially be trapped here. So that is why it's very important to know all these concepts so that you can know what is the optimum size of the particles for which you want to deliver through the inhalation route. So the first effect that happens is this impaction. Later on, if your particle is small enough to travel to overcome this impact and are able to travel here, then the next phenomenon that will govern this entire process will be sedimentation, which is because of the gravitational force. Your particles will travel down, and if they're even smaller, then they'll come across something known as Brownian diffusion. So this is the random diffusion of your particles because they're very very small in size and they are just colliding with each other. So this will lead to Brownian diffusion. So this is the order of phenomenon that keep on happening when your particles are delivered through inhalation. First there will be impact, then there will be sedimentation, and then followed by Brownian diffusion. So as per the question, we have to list the order of these different mechanisms. So according to that, first is impaction, then gravitational sedimentation, and then Brownian diffusion. Is this clear?
Yeah.
Okay, thank you. So the next question is, where will particles of size 20 micron mainly deposit after dry powder inhalation? We have to pick two correct options. So if you know the answer, you can volunteer for the same, or we'll discuss later on.
Alveolar and systemic circulation.
Alveolar and systemic circulation. Okay, we have one response. Anybody else wants to try? Thank you for answering.
4 and 5.
Sorry?
Option 4 and 5.
1, 2, 3. Okay, the same. Alveolar and systemic circulation. Okay, thank you. Anybody else? No? Okay, let's look at the answer. So the correct answer is mouth and throat and large airways. So please read the question carefully. It says where will, if your particle is of 20 micron size, where will it mostly deposit? So if you follow this graph here, you will see that as we were discussing, if you want the particles to go to the deep lungs, the alveolar sacs, it has to be within 1 to 5 micron. If it's a very large particle, let's say 20 micron, so according to this graph, you see that most of it will be deposited in the mouth and throat or in the broader initial airways. So as we were talking few slides back, so this is what your lung network is going to look like. So as I said, if your particle is very large, a 20 micron particle is naturally going to be very heavy compared to a nanometer scale particle. So if you have this 20 micron particle, it's going to have a very large impact on these walls. So as I said, these walls are lined by mucus to trap all your bacteria and whatever you're inhaling. So it's like a filtration through the through this particular route. So as there is a lot of mucus lining these walls, if your particles are more than 20 around 20 micron, they'll impact here and they'll be trapped in this mucus layer. So most of these particles will remain in your mouth or throat area, and in these larger airways they won't be able to reach the alveolar region here. On the other hand, if your particles are very very small, let's say they're even smaller than 1 micron, then what can happen is, because they are very light in nature, they're very less dense and very light in their mass, so during exhalation most of these particles will come out. So they won't even if it's a very small particle, it won't be deposited in this alveolar region. So that's why it becomes important. The 1 to 5 micron range becomes very important. So the question is, where will most particles of size 20 micron deposit after dry powder inhalation? So the correct answer is nose, mouth and throat and large airways. Is this clear? People who are answering 4 and 5, I hope this makes sense.
Yeah.
Okay. Thank you. So the next question is, which of the following statement is false for rectal administration? We have few options. We have to choose the false statement.
Option 4.
Okay. Option 4. Thanks for answering. Anybody else? No? Okay. The correct answer is option 3. Actually, it's widely recommended followed method is actually false. Everything else that is listed down here is the correct information about rectal administration. It bypasses first pass metabolism because nothing is reaching your stomach or the gut area. So that's correct. It's useful for children as it might be difficult to find blood vessels. So rectal administration actually used most commonly used for kids, for children, because it's difficult to find their blood vessel. So that's also correct. Drug degradation by bacterial flora, this could happen because a lot of bacterial flora is lining your rectum. So if you're planning to deliver drugs through that, there are chances that the drug might get degraded, and of course it's very uncomfortable. So the only option that does not fit in this is it's widely recommended and followed method, which is actually not. It's not, as you might imagine, it's a very uncomfortable route of delivery. Clear? Okay. The next question is, which of these statements are not advantageous for intravenous delivery? We have to again pick two correct options. So in a way, we have to list down the disadvantages of IV route. Anybody wants to give it a try? 1 and 2, okay. Thank you for answering. Anybody else? So we have to list down the disadvantages of IV.
Invasive and chance of irritation and infection.
Right, so 1 and 5. So yeah, you're correct. So the first one who answered, half of your answer was right. So we have to list down the disadvantages of IV route. So invasive is correct because you're injecting something, it's definitely going to be invasive. Drug is completely bioavailable is actually an advantage if you want an immediate effect. So in any drug delivery system, you want most of your drug to be bioavailable. That is what all these methods which we are using to enhance delivery are for, that you want to increase the bioavailability, because most of your drug gets lost because of elimination. We don't want that. So IV in that sense is very advantageous to have 100% bioavailability. So that's actually an advantage of IV. Rapid response, as I said, if the patient needs immediate assistance with any medicine, IV route is preferred because most your blood will carry everything at a very fast rate. Bypasses first pass metabolism is also an advantage, and then chance of irritation and infection. As I said, if your formulation is not sterile, there are chances that any pathogen might enter directly into the bloodstream, and now it has access to all your body parts because the blood will carry it everywhere. So the disadvantages of IV route are it's invasive and there are chances of irritation and infection. Is this clear?
Yes, ma'am.
Okay. The next question is, what are the advantages of using inhalers for drug delivery? Again, we have to choose two correct options. So in a way, this is asking us what are the advantages of inhalation route for drug delivery. Any guesses?
Option 1 and 4.
Option 1 is bypasses first pass metabolism and good for delivery to lungs. Okay. Thank you for answering. Anybody else?
Option 4.
Option 4. Okay. So you have to choose two options. So you've chosen one. Do you want to choose another one as well?
Ma'am, option 1 and option 4.
Okay, yeah. So yeah, all of you are correct. The advantages for using inhalers are it bypasses first pass metabolism because it's through your nasal route now, nothing is entering in your stomach lining, so it bypasses the first pass metabolism effect. And then it's good for delivery to lungs because everything, most of whatever you're delivering will go to the lungs, so it increases bioavailability at the lungs. So that's why inhalation route is used to deliver things specifically to the lungs. So these are two advantages. Everything else will be a disadvantage of using inhalers. So that's what you can read in this slide as well. I believe this was the last question for the assignment. Yeah. So if you want me to repeat any of the question here or want me to discuss any concept which you are not very clear about, we can do that. But as far as the assignment is considered, we are done with it. So if there's anything you want me to repeat.
The third question, can you just show the formula?
Yeah, oops, I just closed the screen. Just a minute, I'll share it again. Third question. This one. Yeah. You're looking for this one?
Yes. Yes.
Yeah, it's nothing but the aerodynamic diameter is equal to your physical diameter of the particle and root of its density.
Yeah, thank you.
Welcome. Anybody else wants me to repeat a question? If not, then we can stop this session and I can meet you people next Monday for your week 9 assignment.
Ma'am, I'm having issue in joining the problem solving sessions on Saturdays. I have
Okay.
been trying from two weeks, uh, not the consecutive weeks. So,
Okay.
but I'm still not able to join. It just shows when I click as to join, it just keeps buffering and I'll not be able to join
Oh,
the
okay.
meeting.
Okay. So this is the Yashwant sessions, right? I will ask him if
Yeah,
there is a problem at his end. I'll let him know.
yeah.
Okay. Yeah.
Okay, thank you.
Anybody else has a similar problem or any other problem? If not, then I'll stop the session here and I'll see you people next week.